Hello everyone. Today we are going to discuss Anthelmintics. It comes under 6th semester Pharmacology, Gujarat Technological University, and myself Dinesh Dangar. Anthelmintics. These are the agents which are used to expel out the worms which are present in digestive system. So generally they destroy or eliminate those parasitic worms. Generally we used to call it as helminths, that is from the gastrointestinal tract. They may act by killing or paralyzing the worms so that such worms could be easily expelled out of gut. While coming to the reproduction, these parasitic worms firmly holds the intestinal mucosa and continue their reproduction by egg production. So they used to be present on intestinal mucosa, leading to the further formation of new egg, which could be harmful for the body. They harm the host by depriving them of food, causing blood loss, injury to the organs, intestinal and lymphatic obstructions, and secreting toxins. So these are all the effects that can be observed with helminth. While coming to the types of worms, they are basically three types: cystodes, that is tapeworm; nematodes, that is roundworm; and trematodes, that is flax. Here we can see certain examples of those worms. First, that is common roundworm, that is Ascaris lumbricoides. Next one, that is for filariasis, hookworm, pinworm, male and female, tapeworm, whipworm, trichuris, trichura. Types of anthelmintics. Now, depending upon the accents, anthelmintics can be categorized into two, that is vermifuges and vermicides. Generally, vermifuges expels the worm from the body, whereas vermicides kills the worms in the body. Is like we can previously had a discussion regarding bacteriostatics and bactericidal effect. Now, going with the classification for anthelmintics. First category, that is benzimidazoles. Examples are mebendazole, albendazole, thiabendazole. Quinolones and isoquinolones, that is oxaminiquine, praziquantal. Pyrazine derivatives, that is pyrazine and diethylcarbamazine. Fourth category, vinyl pyrimidines, that is pyrantel, palmoate, oxantal, amides, that is niclosamides. Sixth, that is natural products, like that is ivermectin. Seventh, that is organophosphorus compounds, that is metrifonate. Eight, that is imidazole, thiozoles, that is levamisole. And ninth category, that is used, that is nitro derivatives like niradazole. This classification is taken from the KD Tripathi 6th edition. Here is the another one, that is from the 8th edition of the KD Tripathi. This classification is based on the types of worms present inside gastrointestinal tract. Suppose for the treatment of roundworm, hookworm, and pinworm, we can go with the albendazole, mebendazole, pyrantel palmoate, piperazine, levamisole. For threadworm, ivermectin and the albendazole. For whipworm, Trichinella spiralis, that is albendazole and mebendazole. For the in the cases of filariasis, we can go with the diethylcarbamazine, ivermectin, albendazole. For tapeworms, praziquantel, niclosamide, and albendazole. For hydrated disease, albendazole and mebendazole can be used. Here one thing is common, that is albendazole, that can be used for the treatment of most probably all types of worms. First drug, that is mebendazole. It is basically a synthetic benzimidazole with wide spectrum of the anthelmintic activity, as well as there are less chances of adverse effects, right? So the incidences can be reduced of adverse effects. It is always a drug of choice in the treatment of infections only for whipworm eggs, pinworm, hookworm, and roundworm. Except threadworm. Except threadworm, we can use. These are all conditions with mebendazole. While coming to the mechanism of action, it generally inhibits the microtubule synthesis. How exactly it inhibits the microtubule synthesis? Drug, that is mebendazole, binds with the parasite, that is parasitic beta tubulin, or one component which is present in microtubule, right? So it binds with the parasitic beta tubulin and inhibits its further polymerization. In addition, mebendazole probably blocks the glucose uptake in parasites and depletes its glycogen stores. Efficacy of the drug varies with the gastrointestinal transit time, with intensity of infection, and perhaps with the strain of parasite. While coming to the pharmacokinetic parameters of mebendazole, it can be it can be absorbed from the small intestine, that is generally minimal. Less than 10% of orally administered mebendazole is even absorbed, and the absorbed drug is again protein bound. They may have a higher efficacy than 90%, and it rapidly converted into their inactive metabolites, right, which may undergo first pass metabolism, leading to a half-life of 2 to 6 hours. 75 to 90% of oral drug generally passes into the fecus. So here, the major disadvantage, that is their viability, because the less than 10% of orally administered drug, that is mebendazole, is absorbed into the body, so remaining 90% will be excreted in unchanged form. While coming to the dose, 10 milligram chewable tablets are available. 10 milligram per 5 ml suspension can be given, 100 milligram tablet can be given, and generally it is the most, what we can say, the suitable or the more effective than the albendazole in the many cases of trichuriasis. So it is a drug of choice. While coming to the adverse effects, and that is for mebendazole, albendazole, and ivermectin. Generally they are well tolerated even by the patient in many poor conditions. It may produce mild nausea, vomiting, diarrhea, and abdominal pain. Even certain rare side effects generally seen, that is with high dose therapy, are the hypersensitivity reactions like races and urticaria. Granulocytosis can be seen, alopecia, and elevation of liver enzyme level can be observed with the higher doses of mebendazole, and these are all the rare side effects. Generally, mebendazole is teratogenic in animals and therefore contraindicated during pregnancy. It should be used with caution in children generally younger than 2 years of age, because of limited experience and rare reports of the convulsions in this age group. So it is advised that it cannot be given to the uh, during pregnancy as well as the children younger than the 2 year, because we do not have suitable data for the mebendazole. Okay, uses. They are effective against whipworm, that is trichuria. Next is the pinworm, that is Enterobius vermicularisis, for the treatment of hookworm and Ascaris lumbricoides. Albendazole. It is a broad spectrum oral anthelmintic agent. It is the drug of choice for the treatment of hydatid disease and cysticercosis. It is also used in the treatment of pinworm and hookworm, roundworm, whipworm, and threadworm infections. As we have seen during classification, that albendazole is a drug of choice and can be used as a first choice of treatment in the cases of anthelmintics. Generally, one dose treatment is effective against the roundworm, pinworm, and hookworm infections, which are comparable to 3 days treatment with mebendazole. 3 days treatment is necessary for tapeworms, including Histolica nana, and it has weak microfloricidal action, and their mechanism of action will be is similar like mebendazole, that it inhibits the beta tubulin, so that further there won't be a polymerization of those microtubules, leading to the expulsion of the those roundworm tapeworm. Clinical uses: generally it will be administered on empty stomach when used against intraluminal parasites, but with a fatty meal when used against tissue parasites. It can be used in the cases of ascariasis, trichuriasis, hookworm, and pinworm infection in the dose of 400 milligram oral per adult, and for children older than 2 years of age, repeated 2 to 3 days for the heavy ascariasis infection as well as for the 2 weeks in pinworm infection. In cases of hydrated disease, adjunct to surgical removal or aspiration of cyst. 400 milligram twice daily with meals for 1 month or longer, and the daily therapy for up to 6 months has been well tolerated. Even it can be used during neurocystic psychosis, that is corticosteroids generally are given in the anthelmintic drug to decrease the inflammation that is caused by the dying organism. Albendazole is given in a dosage of 400 milligram twice a day for up to 21 days. And in cases of other infections, the treatment of cutaneous larva migrans, that is 400 milligram daily for 3 days. In cases of visceral larva migrans, that is 400 milligram twice daily for 5 days. For microporidial infection, 400 milligram twice for 2 weeks or longer. And for gnathostomiasis, that is 400 milligram twice daily for 3 weeks. Next drug, that is after mebendazole and albendazole, that is piperazine citrate, that is artemisinin, sorry, that is artemisinin and dyspermine. While coming to the mechanism of action, it blocks the responses of the ascaris muscles to acetylcholine, and this blockage can causes the flaccid paralysis into the worm, and this flaccid paralysis lead to the dislodged from the intestinal wall and expelled into the fecus. They are highly effective against the ascaris lumbricoids and the enterobius vermicularis, that is for roundworm and the threadworm. We can use piperazine citrate. Thiabendazole example, that is mentazole, and the IUPAC name is that is 2,4-thiazole benzimidazole. While coming to their mechanism of action, again same like albendazole and mebendazole, they bind with the beta tubulin and inhibit the polymerization of microtubules. Here, beta tubulin is the precursor of formation of microtubules, thereby they arrest in cell division in nematodes. So those in nematodes may have a arrest during their cell division, and further they cannot undergo multiplication, and there won't be a formation of those newly developed egg. Which kinds of biochemical changes can be observed? That is, one is inhibition of mitochondrial fumarate reductase, as well as it reduces the glucose transport and uncoupling of oxidative phosphorylation. It has a broad spectrum anthelmintic activity. They are used to treat enterobiasis, that is a type of threadworm infection, ascariasis, that is roundworm, trichuriasis, that is whipworm. In addition to its use in human medicine, it is widely employed in veterinary practices to control helminths. So, in cases of veterinary practices, generally thiabendazole are used. Next drug, that is niclosamide, that is cystoside, manzolini, and yomesan, that is 5-chloro and 2-chloro 4-nitrophenyl 2-hydroxy benzamide. Their mechanism of action, they generally inhibits the anaerobic phosphorylation of adenosine diphosphate by the mitochondria of the parasite itself, and it interferes with the anaerobic generation of ATP by tapeworm itself, so leading to the removal of those worms. So it inhibits the separation and blocking glucose absorption by the intestinal nematode function. Uses. These are the agents for choice for the treatment of Taenia solium and the Taenia saginata. A saline perk that is for 1 to 2 hours after the ingestion of this drug is recommended, that is to remove those damaged scolex and worm infections. Quinacrine that can aid for this purpose also. Next drug that is praziquantel, that is biltricide. It is 2-cyclohexyl carbonyl 12367 11B hexahydro 4H pyrazino 21A isoquinoline 4,1. It increases cell membrane permeability of the susceptible worms, resulting in loss of intracellular calcium and loss of extracellular sodium. Massive contractions and the ultimate paralysis of the flux musculature occurs. The worms may lose their grip to the intestinal mucosa, and it will be removed from the site of intestinal mucosa and expelled out from the body from the fecus. While coming to their use, it has become the agent of choice for the treatment of infections caused by flux infections. So this is all about the anthelmintics. What we have seen during today's lecture, that is the classification according to the chemical structure or chemical moiety, as well as according to the type of infections, with the certain examples of infections, certain types of infective specific worms with mechanism of action, contraindications, adverse effects of albendazole, mebendazole, pyrazinamide. Thank you.